Pennsylvania's Human Services Department, that's the department that manages the state's Medicaid program. It also has the largest budget across the Commonwealth. And while federal funding, it's on the line, state lawmakers have their own in-house issues to deal with. Our Pennsylvania State Capitol correspondent Kara Jeffers reports live from Harrisburg tonight. Kara?
Good evening, Nick. Just over 3 million Pennsylvanians are enrolled in Medicaid. There's over 30,000 in our viewing area alone. These are seniors, people with disabilities, maybe someone who works but their job doesn't offer health insurance. Pennsylvania is spending more than it's taking in with revenues, but Medicaid costs are on the rise. It's putting Pennsylvania lawmakers in a tough situation, and federal pressure isn't helping. Tense discussions in Harrisburg.
I can't say no. You know, I really respect
that's
what you're
a good
saying,
question, though.
but we can't say no to people.
Are there any entitlements that should be repealed?
As Pennsylvania's Human Service Department answered questions on their budget this week.
It's a big budget, right? $21 billion budget request, up, $2 billion more than we were just 1 year ago.
Most of Human Service funds go towards Medicaid. Inflation and a more sick Medicaid population put the department in the red last year. Conversations over state policy, though, were complicated by looming federal cuts. If passed, states could see, by rough average, a 15% decrease in federal funding each year for Medicaid.
The particular ways in which the program will be cut would fall on state politicians and policymakers. That's not going to be determined at the federal level.
Republican lawmakers say potential fraud and poor efficiency could justify cuts or denying a spend increase at the state level.
We still have to provide for those needs, though, but we also have to look again at, are we delivering the most efficient products and services that we can within human services?
Democrat lawmakers remain focused on future hard decisions.
These type of cuts would be catastrophic to either our ability to cover our fellow Pennsylvanians or to the taxes of every Pennsylvanian if we were to try and make up the difference, to the tune of billions of dollars.
An example of one of those specific cuts for those working Pennsylvanians who are on Medicaid. Around 800,000 who got on because of Medicaid expansion in the mid-2010s. That's something that if the federal government chose to not fund that, it would be left to state lawmakers to decide if they want to continue offering those services. In Harrisburg, I'm Kara Jeffers, WENY News.